Hey guys, welcome to Tales of the Aquarius. My name is Emmanuel and this is
Sammy.
And as you've seen from the title, we ended up spending 35 days in the NICU. What we're going to do in this video is to explain what happened during this period. And if you watched the last video, you would see, or you would have seen what the delivery process was like. What you didn't know was that immediately the baby was born, we ended up spending just a very short time with the baby, and then she was taken away from us.
Yep.
So what happened? I think the first thing they had to do was they put in a tube through her nose, and then they took her for a heart examination. And do you want to give us context on why?
So for context, during the second trimester, if you've seen that video, you would have seen the part where we said we're going for a fine diagnostic appointment, which is an appointment where they basically check all the organs of the baby to see that the baby is developing properly. So during that appointment, we found out two things. One of the things was it's called what's it called again? Duodenal atresia. Thank you. And what is duodenal atresia? So duodenal atresia is either a narrowing or a blockage between the stomach and the intestine. So this was something that they did see that she had, also known as double bubble. And we were already told that when she is born, she would need to have a surgery where they would reconnect or open up the blockage. So the second thing that they did find was a heart defect, let me put it like that. So there was the VSD and PDA. So the VSD, of course, is generally known as a hole in the heart, and they of course saw this, but they were also not very sure of how things would go. So that they couldn't tell us if there would be a surgery or anything. They just said, okay, this is something that we would look at immediately she's born and see what the severity of it would be, and decide on what to do next, because some babies are born with a hole in the heart, but then it closes after a couple of days outside, like outside the womb. So these were the two major things. The PDA was not really something to be bothered about, at least according to what we were told. So we did expect that there would be that she would be taken from us and she would spend some time in the ICU. But then what followed afterwards were things that we did not expect, like we did not see this coming.
Yeah. So they did the check. They found out that the heart was stable. Mm-hmm. So they said, okay, since the heart is stable, then they would go ahead and do the duodenal atresia surgery. So they took her straight to the NICU to maybe monitor her and then prep her. Also, she couldn't feed, so she needed to take nutrients through. How did they pass it? I think they passed it through the IV, and the IV was in her navel at the time. So that was basically going to give her the nutrition that she needs to grow while we wait for the surgery, because she can't eat anything, because when she eats she will throw up, and then can throw up and go into the lungs and so many other complications. So she stayed in the NICU for, I think, how many, 2 days, 3 days?
Yeah, it was 2 days. I was discharged from the hospital because, of course, it was a vaginal birth. In Germany, they don't keep you that long. So I was discharged from the hospital 2 days after giving birth, and then the surgery was for the day after, so the third day.
Okay. So they, of course, explained how the surgery would be performed. And according to them, it's a standard procedure. So what they would do, or what they had done, was they would tear a part of her right stomach, and then they would basically bring out her they would bring it out, and then they would find where the blockage is. So imagine that this is the stomach, and then there's this narrowing right here. What they would do is they'll cut a hole here, and then they would join it like this here. So I don't know if this was easy for you to picture, but now they will join these two holes together, and then food can pass through. So that was the general idea of the kind of surgery that they had to do. They said, yeah, it was quite standard, so they didn't expect any complications. But then they did the surgery. They told us that everything went well. But then I think maybe the next day, right, or 2 days after the surgery, like, did we find out the next?
So I think I think it was basically the next 2 days. It wasn't long.
Yeah.
So I think the next 2 days, because I didn't go to the hospital with you, do you remember?
Yeah.
So after the surgery,
Okay, good. Yeah.
so the surgery was done on a Friday, and then I was home on Saturday because I had just given birth. So I saw her on Friday after the surgery. She was basically knocked out. So on Saturday I had to stay back home. Family came around to help me with the healing process and everything. So you went to the hospital alone to see her on Saturday, and then on Sunday was when everything happened. So on Sunday, we got a call on Saturday saying that we needed to come into the hospital on Sunday, that they needed to explain something to us. So again, I couldn't go, so you had to go Sunday, and then you called me from the hospital. So
what they had found out was that her Methemoglobin was high. So just to give a little bit of context, we have our blood, and in our blood, the hemoglobin transports oxygen. And in the same blood, there's a specific percentage of methemoglobin, which in a normal case should be about, I think, between 2 to 5, maximum of 5%. So less than 5% methemoglobin. And methemoglobin doesn't carry oxygen. So just think of yourself in a group of, it's like project group. There's one person that doesn't do anything while the others do all the work. This one person is the methemoglobin. But in her case, she had how many? And initially was 20%.
At the time, it was 24.
Okay, so let's say 2 people out of 5, if the math is correct, were not doing any work. And then what happened was that this caused her oxygen level to be low. As a human being, we need oxygen to survive. If your oxygen level is low for a while, it causes a lot of damage. It can even cause like neurological damage and even death if it's too bad. So her methemoglobin was high at this time, and then it got worse in the following days. It got up to, I think it was like 36, right?
No, it got, the highest was 30.
30? Okay.
Yeah.
So it got up to 30 in the following days. So 30% of her blood had she had 30% methemoglobin, when she should ideally have less than 5. So this was a big deal. And at least from research, there are different things that could cause this. It's maybe the medication that she may have been exposed to, that she's reacting to. It could also be genetic.
It could have also been medications that I took during the pregnancy. So this was something that they asked us, because when you called me from the hospital, after the doctor finished telling us what was there, the doctor then said that they had taken the list. They had the list of all the medications I had taken during pregnancy. So they had the list of medications and all the medications they gave her during the surgery and I think before the surgery, that they had all of that, and that they were going to test every medication to find out what actually caused that, because at the time they didn't know what caused it.
Yeah. So the goal is that they want to find out what triggered the spike in methemoglobin. And if they find out what triggered it, then moving forward we can avoid it. And so that was basically what they had to do. So they were doing a lot of research. They also took our blood to check whether we may have something similar, to know whether it was hereditary. So they didn't find anything. They continued to do their research. But while they were doing all of these things, they also gave her vitamin C therapy.
No, which she was given vitamin C
after it was going down.
Yeah, so the methemoglobin level had already started going down when they gave vitamin C, and we were told that the vitamin C was going to help to reduce the methemoglobin. But of course, she had to at first have started taking it for at least 8 days before you could see any effect.
So basically, it went down not because of the vitamin C. So they still didn't know why this happened. They don't know why it went down, but it started to decline, which was good. So and one other thing was that because when she was in the NICU, she was always connected to different like machines. One is checking the heart rate, checking the oxygen level, and what was the other thing? The pulse. So the oxygen level on the machine was always low. So you would see sometimes 70%, sometimes it would go down just dip. It would dip to maybe 60, 50, come back up to 70, stay around the 80s. So not so good. If your oxygen level is low, like we said earlier, it's bad. So during this period, she was also on constant oxygen to help her breathing, to also make sure that the hemoglobins that are actually doing the work take as much oxygen as they can. So they gave her more oxygen so that it would also help. And she was really small, so there are times it's like she's learning to breathe, and there are times she would just stop breathing for a few seconds and then get back and then continue breathing.
So actually, in terms of that breathing, there are actually two things. One, they say it's normal for babies to stop breathing, forget to breathe, and then, for a few seconds and then continue, because when they come out to the world, they are learning how to breathe, because they don't breathe while they are in the womb, because of course, oxygen is being passed through the placenta and through the umbilical cord to them. But then when they come out, they of course have to learn how to breathe. But in her case, that was just not the only thing that was stopping her from breathing, which then brings us to the next thing that happened. I would say massive infection, basically. So we had been told earlier that the surgery was successful, there was no complication, everything went well. But then a few days later, after this whole methemoglobin thing, while battling that, we're then told that she had a very, very, very high bacterial infection, and they didn't know where that came from. So it wasn't picked up early. It had gone up to 180 something before they realized that she had it. And it was also not from the surgery, because surgery had gone well and there was nothing. So where this bacterial infection came from, we don't know. So this bacterial infection, because of how high it was, and of course for a baby, she was having the breathing apnea, where she was now forgetting to breathe even more and for longer times. And she was also swollen. She had a lot of fluid retainment in her body, so she was really, really, really swollen. Her legs, her face, everywhere was swollen because of it.
She was even swollen so much that her eyes, you couldn't really see her eyes. Yeah, it was really bad. So this infection went on for a while. They of course they gave her antibiotics to sort of fight it, and positively she was responding to it. So it was going down, but it was going down really slowly. It's like every day they are checking, they see that it's going down, but it's still high. So yeah, they just kept checking, kept giving her the antibiotics.
A little digression here. For a lot of people who do not know what the NICU is like, I think I would say it's one of the most traumatizing experiences, having to be there every day, because of course we're not in the hospital, so we had to go to the NICU every day, literally. And after the first 2 days that I didn't go, I was basically going to the hospital every day while still trying to recover from just giving birth. And then when you get into the NICU, you're seeing really, really small babies. There was this day that I think that day you went to work, so you were to join me after work. I went to the NICU, and at the entrance there was this there were candles and a star, at one corner, and then there you would see, that day I saw baby's date of birth and then the candles, which basically meant that those babies slept, for lack of a better word. And I panicked, because literally a few seconds after I was entering her room and realized she wasn't there. of course, all of the negative thoughts just started running through my mind. I almost started crying. And then I came out and I was looking for a nurse. I'm like, where is she? Where is she? And they're like, oh, they changed her room. So they then had to move her to another room. Oh, one thing I forgot to mention. Well, they moved her to another room. So, my mind came down. And then I went to the other room to see her. But that was a very traumatizing experience because all I could just think of is, so probably somebody else came to see their child and their child wasn't there, their child was gone, and it was really, really devastating. So yeah, that was something that every time I think about it, I just cannot stand how I felt in that very moment. And then also we forgot to mention that the bacterial infection was so much that they had to isolate her. So they had to take out the other baby that was in her room and sort of like barricade, because there was a connection between her room and another room, and then they had to barricade that part, and she was left in her room alone. Like she had to stay alone in the room because of fear of passing the bacteria the infection onto another child.
Yeah. So, yeah, you can already hear all of these things happening, and while these things were happening, we got a chance to speak with the surgeon. So the surgeon had called and wanted to give us sort of an update. Apart from just that the surgery went well, they wanted to tell us what they found. So apparently they found something else while doing the surgery. So what they found was, they said that she had intestinal malrotation. So this is I'm not entirely sure exactly how I would explain this, but your intestine has a way that it should grow or it should form in the body, and hers is formed a little bit differently.
The opposite way.
The opposite.
Literally, yeah.
Okay, and then it's like there's something that should be at the left, it's at the right.
Yeah.
At the right.
I don't actually remember. I think is it the colon or the bladder? Something is on the other side. So typically, the appendix rather. So it's the intestine goes clockwise. So it starts from this way before it goes this way. Hers starts from this way. So the opposite, anti-clockwise.
Okay, but I don't know if it's the entire one or just a part.
No, it's the entire thing.
Okay. So, but yeah, we found that it's like, why are we still hearing different other things that are happening? And they're telling us that she has intestinal malrotation, but at least the doctor, the surgeon, had assured us that she just had to tell us, but that many people live a healthy life without any need to do anything. But it's good for us to be aware, because there's a risk of something called volvulus. Is it volvulus?
I don't know.
It's like, I think it's like a tie. It's when it now becomes really tight, and then it will cause a whole lot of pain. In fact, if that happens, then it's instant emergency surgery that they would have to perform. So it's just for us to be aware, so that if she ever experiences any kind of intense pain or something like that, then we immediately go to the hospital and also mention that she does have the malrotation, so that it's something that they can check.
Another thing that they said was that so the reason for the double bubble was due to this malrotation, and also the fact that the pancreas then, like, it's sort of like in a ring shape, for lack of a better word, went round the intestine. So that was what caused the what caused the blockage. And so we then asked for that, like, okay, how could this have happened? And they said, well, again, they don't know. So typically when babies are being formed in the womb, the gut comes out and then is formed, and it goes the way it's supposed to go, and then it goes back into the stomach. That's how it was expelled, into the abdomen. That's how it happens. But in her own case, it came out and then it formed, and instead of going the way it was supposed to go and go back, it sort of stayed that way and then went back inside. So that was basically what happened, and there's actually no cause. Like, they don't know. It's something that can happen. Think of it as a glitch in the system. It just happens. And that was basically strange. But again, this was something that we had to deal with, and still dealing with, in the sense that hasn't changed. That's basically how she is. So that was the next phase of.
Then one thing I just wanted to mention was, every time they mention one thing that's happening with her, and they tell me, oh, this is very rare, and I'm like, and then sometimes you hear, like, when you check the odds, you're hearing 1 in maybe 10,000, like, so many. The odds are really low. And the question I ask myself is, why is she being the one in so
10,000.
many cases? So it's like something that I really couldn't understand. It's like, if it's like, imagine that there's 1 in 5,000 chance of being blind, 1 in 50,000 chance of being crippled, 1 in X, and then I'm blind and I'm crippled. So it's like, what is the chance, or what are the chances of having all of these at once? It should even be lower. So
and sorry to cut you short. And then also something that just sort of struck us was the fact that while they were trying to do all these genetic tests, which of course they did a lot of genetic tests to find out what was causing all of this, and I think maybe now is a good time to say that all these results came back negative. Like, she didn't have any of these genetic issues. But something that struck me was the fact that this was something that I would say we were knowledgeable about from the very beginning, and from the very first trimester we opted for the NIPT test. So an NIPT test is a test that they do during like the early stages of the pregnancy, taking like the mother's blood, so my blood in this case, to check what are the chances that this child has trisomy 18, 13 or 20. I think it's 21. So these are like these three genetic issues are things that this test actually checks out. So like Down syndrome, Edwards syndrome, and I've forgotten the name of the other one. Maybe Patrick. I don't remember if it's Patrick syndrome, but yeah. So these were the three, and we made sure that we did that test. Like from the very beginning, I opted for the test, I did it, and it came back negative. So we were actually really calm that, we didn't have to deal with all of that. So then hearing at this particular stage that, they want to do genetic testing, it's like, okay, what are for people who were clueless, it was like, what other genetic testing are they doing? Because they did this one and it came back negative. And we started hearing different types of genetic tests and genetic issues.
Yeah, it's like before all of these things that we've seen, I always only thought that there was Down syndrome because this is like the most common. But because of the circumstances that we've been in, I've basically learned about different other ones, the ones that are even way worse, and it's just been a huge learning experience, I would say.
Yeah, I remember the first time they found out about the double bubble, they asked us if we would like to do an amniocentesis, which was to draw like amniotic fluid from me while I was still pregnant to check if there was, again, the same, actually it was still the same genetic issue, so the same trisomy and all that, because they said the amniocentesis was more so it was more accurate than the NIPT.
So the NIPT is a screening that would basically measure the probability of having maybe Down syndrome or Edwards syndrome. Yeah. So you'd have the trisomies. But this amniocentesis is going to actually check if there is an extra chromosome. Yeah, it's going to check it itself.
Yeah. And they had told us that, but they first had to tell us again. I think this is something that I like it, but then I don't like it in this country, where they would tell you all of the, like, everything, and you make your decision. They have to tell you whether it's good, whether it's bad. side effects, even if it will affect you or not. They just have to tell you everything. So they said, but that we have to first decide that should the result come out positive, then there was that option of having to take a pill and basically let the baby go to sleep, and then I would have to be induced into labor to give birth to the baby and end the journey there. Obviously, at this point, I was about 6 months pregnant, and that was not an option. While she was in the NICU, they had to take blood from both of us to do some genetic tests, because they also wanted to see if this was something that was from us. And they started asking questions about our family background, like health and all that, just to know what they were working with. Now, mind you, this sounds like it was just chill, but trust me, everybody was frantic. Like, imagine the doctors of like the 6th best hospital in the world saying they don't know. Like, they don't know what's causing the methemoglobin level to be up. They don't know what's going on, and they have to start doing research immediately. That was basically where we were at that time. I think it's very important to add that throughout this time, we were really, really prayerful. Like, we just kept telling God that you would not bring us this far and just leave us hanging like that. Like, you have to do something. We are clueless. We don't know what's going on. We are first-time parents. Everything is strange. And like all these medical terms that we're hearing them for the first time. I believe that at the end of this whole thing, like, we should be giving medical degrees because we heard so many things. We did research. It was a lot. And of course, if doctors are telling you that they don't know, then you sure know that the only person that knows and understands is God, and that's the person, or that's who you should be running to. And that was basically what we were holding on to, who we were holding on to throughout that time. So every day we were praying. Every day, like, family and friends were praying, and we just kept holding on to God to do a miracle. So when we then heard that the methemoglobin level had started going down on its own, without an explanation, it was not a medication or anything, it was apparent that that was a miracle, because there was no explanation to why it was then going down on its own. Of course, if we want to use science, we understand the bacteria infection part because she was on antibiotics, but the methemoglobin, which was the scary part, was going down on its own without any medical intervention.
So after that, while all of these things were happening, of course, the surgery had happened. It was successful. So the next phase is to watch the healing and then try to introduce food. So while they did the surgery, they had passed the tube directly to the duodenum, or the intestine. And what they now used this tube for was to pass milk. So they would pass milk directly to the intestine, then it would go do the digestion, and then basically testing out the what's it called? The digestive system in general.
Yeah.
So
we were told that she would only be able to go home if she can eat properly, digest properly, and gain weight. So these were the three parameters that they had to check before she would be let free, before she would be allowed to go home.
Yeah, and the process was supposed to be, first of all, they would pass milk directly to the duodenum, then they would pull the tube up to the stomach, and then they would pass milk to the stomach. Then they would feed through the mouth, and then so from the mouth, then it's the full
time to go home
digestion. So what they did was for about a week, right?
Yeah. So we forgot one part. While all this was happening, one day we came to see her, and she was under the blue light.
Ooh.
And then what happened? She has jaundice. What's going on? Her eyes were yellow. Her entire body was yellow, and
then she was fat.
She was still swollen from the food. Yeah. And they tried to explain that because of the surgery, because this is like a delicate part of the body that you're not even supposed to do a surgery on, there was the then slow passage or slow movement of the bilirubin. So she had like really high bilirubin levels, and it was now going to take longer for it to sort of clear out. So they told us it was going to take weeks. And yeah, so even though she was under the blue light for like 6 hours, she was still yellow for a while, like so. And even like her pee was so yellow that it was staining like the diaper, it would stain like the bed, like it was yellow. That sort of like the color was really intense. So after that, of course, that was now slowly clearing out. It took a while, but it was slowly clearing out. And then you can then talk about 2 weeks after or 3 weeks after.
Yeah, so for about a week they were passing milk directly to the duodenum. So I think they started with 5 ml.
Yeah.
So it was per hour. So 5 ml per hour. Yeah. And then
it was actually 2 ml per hour.
Sorry, 2 ml per hour, because that sounded a lot.
Yeah.
And then the syringe would automatically be passing the milk directly, and then her system was good.
And
so
then it increased to 5 ml.
Yeah.
And then 7
ml.
And then 10 ml.
Yeah. And then they now started to try directly from the mouth, because it seemed like it was doing well. The healing from the surgery site was also pretty good. So they tried bottle feeding, and I forgot what the measurement was.
At the beginning, I think it was like 5 or 10. I don't remember, but I remember like being so happy when I got there that day, and they said, "Oh, you could try feeding her with the bottle, but you start slowly." I was so excited. I took a picture and I'm like, "Hey, look, she's about to, feed directly from the mouth." I think I'm going to add a picture of it, because I don't remember how much food it was, but yeah.
And it was a big deal because, like, since she was born, she had not
tasted food,
and she had not also engaged her suck reflex.
Yeah.
And if she forgets, then that's a problem.
Yeah, so that was something we were scared of.
Because we're so excited, like whenever we just see her do, like it's always so
happy,
refreshing, because it's like, oh, she still remembers. Because if she can't suck, she can't eat, then she depends on the IV, and
that would be another problem.
Yeah. So she gradually increased the dosage. We went, I think maybe the entire process of milk and adjusting took about 2 weeks, where she finally was able to eat 50 ml, right? 50 ml from the bottle, from the mouth. And this was good. So the next phase was during this process, they now went back, because if you remember earlier in the video, we mentioned the issue with the heart. So what they did was they now did an echocardiogram. Yes. So basically checking the heart and seeing how it's working. So they did that, and they saw these issues that they had suspected in the second trimester. This time is clear because they can check, do a ultrasound, and then they can see it clearly. So they could see the VSD. They could see that.
Sorry to cut you short. I mean, just for context, VSD is basically ventricular septal defect.
Yeah.
So you can Google it.
So yeah, they saw the VSD. They said it was moderate size, so it was not small but not large. Then they also saw something where the left ventricle is slightly smaller than the right ventricle. This one, they say they need to monitor, because they're not sure whether it is bad or whether it's going to have any kind of significant impact. But for now, it's not really a problem. The main focus at this time was the VSD. So basically, what was happening was blood is circulating, right? Or she breathes in. What should happen is that the blood gets oxygenated. But what now happens is, when the blood is oxygenated, it passes through the hole into the other part and mixes with blood that is not oxygenated. So it sort of makes the heart have to pump more and oxygenate even faster. So I hope I got this explanation right. If not, if there's any doctor, feel free to correct me. But the heart was doing a whole lot of work, and if the heart is doing a whole lot of work, it gets bigger, and if it gets bigger, then it's a bigger problem. So what they did was they had to put her on different medications to sort of reduce the work that the heart is doing, so that the heart doesn't do so much. So she was on this medication while in the NICU, but since the surgery with the stomach was good, and they didn't want to do any kind of heart surgery at the time, because they say the best time to do a heart surgery is later. It's always better to do it later. So because later on the heart is bigger, the body, the child is stronger, and because the heart is bigger, it's also easier to perform the surgery. But the smaller it is, you know, they say your heart is as big as your fist. Now imagine a newborn's fist, and then imagine trying to close a hole. Is a lot more difficult. So what they wanted us to do was to go home and continue with a therapy, a plan that they had come up with, a diet, if you will. So she had to take maximum of 60 ml of milk 8 times a day, and then all of her medications at different times.
And mind you, for her age, 60 ml is really, really small. So I mean, twice, right? At the time of recording this video, she's almost 3 months old, and she should be taking almost 3 times that amount. But then she's stuck with taking just 60 ml and then 8 times a day. And then the 60 ml, because they said that the heart is, because they said that she needs to put on weight, but then she can't eat a lot. The diet then had to have so we then had to mix her milk with protein supplement and like some oil to make the food calorie dense, but then small quantity. So she eats small quantity, but then takes in a lot of calories.
And basically the thing is, whenever breast milk has liquid, and the more milk she takes, the more liquid she has, and what they're trying to do is reduce the amount of liquid in her body. So that's why she also pees a lot more, because of the medication. So now she's taking less milk, 60 ml, less liquid, and then more calories. So so this was basically the diet that she had to be on. She was on that diet for a couple of, I think maybe a week.
About a week.
In the hospital. But now they want us to go home, because the heart surgery has to be delayed as long as possible, and the stomach is doing well. So just before we were about to go, they said we should do a
rooming in.
But even before the rooming in, they did a hearing test. So they had done a hearing test on her. So first of all, they had done an inner hearing test when she was born, and some examinations for newborns. But now they did a hearing test, that where they put something here and then connect whatever, and then they play sound, and then they do listen to brainwaves or whatever. And then they said that she failed this test. So she failed the test, and they said we should go to a specialist, an audiologist, so that they can basically check what is wrong. So we went there later that same week, and they did the test, and then they noticed that she passed the inner hearing test, and then her eardrum is vibrating, which is good, but the curve at which it's vibrating is a little bit lower than it should normally be. But they also mentioned that it could be it's very common for children around her age to have liquid or blood or whatever in the ear
from the womb.
That could cause this kind of hearing loss, or just make the vibrations to be a lot less. So we have follow-up appointments for them to check. So just to give time for whatever fluid to sort of clear out, and then they will check again. But I remember how I felt when I heard this. There was a time when I heard that, like when they had told us that she failed the test, I was in the office and I just went, like I was going to the bathroom. I opened the first door, and when the door closed, I could hear that sound. And I don't know why this was the only thing that occurred to me, but my mind was like, are you telling me that my daughter will not be able to hear the sound of a door closing? Then I was thinking, I was like, so how am I going to communicate with her? Like if we are sitting down, because I'm a very family oriented person. I like to sit down with my wife and my children and then we insult ourselves together. How would I do this? How can I tell a joke to my wife, or how can I yab my wife and expect my child to laugh? How can I yab my child for her to understand? So it's like, for me to communicate within my family, I need to speak and I need to gesture. So these were just thoughts that were running through my mind, and I don't think I've ever felt this devastated in my life. Like I was basically broken. I don't know how I would explain again how I felt, but there was this song that I saw. For whatever reason, I just opened my phone and I was like, praise songs. I think I searched on Google, and then there was this song from Maverick City that came up, and I listened to it just before I went to the hospital for the test in the audiologist department. And when I heard this song, I actually cried in the bathroom before I went out. But that was how much the situation hit me. Like it hit me even more than every other thing that they had said hit me. But in the end, we went, and I even asked the doctor clearly, is my daughter deaf? And she was like, no, of course not. Like she's not. These are just like she basically explained that she's definitely not deaf, which was it was a relief for me. But it also made me appreciate hearing. Like I had never really, when they say you don't know what you have until you lose it. Like I wake up every day, I open my eyes, I see stuff. I wake up every day to the alarm that I hate, and I'm angry. But at this time, I was like, it is really important to be able to hear. It's really important to be able to see. Yeah. But I'm also curious to hear how was your own experience when they said.
So I think that day when they told us that she had failed the hearing test, for me it was like, I mean, of course, now remember that throughout this time, all we've basically been doing is praying, right? We've been praying. And I think I want to go back to even while I was pregnant, when they first told me, they've seen the double bubble, she would need surgery after. I could not comprehend how a newborn would have to already do surgery. I mean, I'm this grown and I've never had a surgery in my life. And it's not something I ever want, at least if I have the power. So hearing that a newborn that's about to start life would have a surgery immediately she's born was very devastating for me. And all I could think of is, I wish I could take your pain, and I wish this didn't happen. So I really had a lot of faith. I mean, I still do have a lot of faith. And I kept telling God that it's still possible. Like, you're the one creating this child. It's still possible that you can basically make her whole, and she wouldn't need to do any surgery and all that. That was my prayer at the time. And as much as the doctors prepared us for the moment, we signed documents, they spoke to us, because they would always speak to you before they perform any procedure, even take blood, they would explain. So as much as they said this, because I kept making those prayers, I subconsciously did not expect the whole NICU experience. I just felt like, my daughter is going to be born and we'll come home with her. She wouldn't have to do any surgery, to the point where I packed clothes for her, like coming home clothes, when I went to the hospital, when I was going to the hospital to give birth, and then I packed those same clothes back home without my daughter. And it was really, really devastating. Now imagine holding on, I've gone from, God will fix this, it wouldn't happen, to, God, this is happening now, so I need you to do something. I need everything to work out perfectly. And then the surgery went well. It was fine. I'm like, thank you, Jesus. This has been done. And next thing, I'm hearing about the Methemoglobin. It's like, God, there's another one I'm telling you about, or this one has to be fixed. And then he fixes that. And then I'm hearing about the bacterial infection to the point where I think it was like every day we went to the hospital, we would ask, what's the level of the methemoglobin today? What's the level of the infection? And then they would tell us like maybe it has gone low, and we would give glory to God that day. The next day we would ask again, the number would have gone low. We would give glory to God. Every day we were doing that until it had normalized. And then so we were basically preparing to go home. We were supposed to, they said there's this thing called the rooming in, where as a parent to a sick child, they would bring you into the hospital. You would stay in the hospital for a few days, where they would teach you how to give the medications to the child till you feel comfortable that you can take care of this child at home. Then they would discharge the child, of course, with you. I'm documenting this very moment when I'm about to leave the house for rooming in, and if I ever post this on YouTube, then you would already know what a rooming in is. But I've been waiting for this day for a month now, and I am so excited. I could not sleep. I woke up so early this morning, and at about 9 a.m. I called the hospital and they said, yep, we're confirming you can come in for rooming in starting today. And it is so exciting because I get to... Oh God. I'm going to be spending the night with my child for the first time in 1 month. She's going to be 5 weeks old tomorrow, and it's going to be the first time I will be spending the night with her. It is crazy, Jesus. Ooh, thank you, Jesus. I just wanted to document this very moment, exactly how I'm feeling, because I want to look back at this video and remember the exact emotions that I had at this very moment. Whew, it's been a long journey, but yeah, we're here. I'm not taking it. I'm going with the factory. So we were preparing for rooming in. We had been told, oh, they're even looking for a spare room. I know how happy I was when they told me we're looking for a room that you would stay with your baby, and would teach you how to, make her food, give her medications and all that stuff. And then I think 1 or 2 days to that, they then came for a hearing test. So for me, it was just like, yeah, just another thing, we're preparing to go home. And the doctor was like, she failed. So at that point, it was like I had been holding on. It was like, okay, one day at a time. And this was over 4 weeks, basically 5 weeks. And then there's a new thing coming. Instantly, I think I told him that I was hungry. I was hungry. But then it was like I was going crazy. So I left the room, went towards the canteen. And I stood, before I got to the canteen, I stood somewhere between the ward and I think on the way to the canteen, and I started laughing. I just started laughing because I'm like, no, the devil is still trying something. Come on, he's throwing a tantrum. God has won this battle, and he's saying that we can go home. And the devil is just throwing a tantrum because he doesn't like that this story is about to end well. And I called my friend Ola, and I'm like, I'm losing my mind. I've been holding on till this point, but I'm losing my mind. And she's like, what happened? And I'm like, they said my daughter cannot hear. That was basically what I just said. And it was like my friend got angry. It was like Ola got angry in that very moment, and she's like, what do you mean? It's not even possible. And then I'm like, they just did a hearing test. They said she failed. And she said, no, we're not accepting that. We are not accepting that. God cannot even do that to us at this point. So we are back to prayers. And instantly, she and her family started praying, and they started giving me Bible verses. This was just for a few minutes that I left, and all this was already happening. She gave me Bible verses. She started telling me the Bible verses that I would pray over my daughter. And then she told me to calm down. Basically, this has been done. God has perfected it. And then I called my mom as well. And I was like, she was asking for updates. How is everything going today? I said, fine, but this is what they've said. And I'm like, I'm tired. It felt like, everybody keeps saying, oh, you're strong, you're holding on. And then typically, it's usually that very tiny thing that just basically, so it felt like this was that tiny thing that was making me fall apart. And she kept saying, no, you can't cry. Why would you cry? You have a child. So as a mother, you should be strong for your child. So this is not the time to cry. This is the time to pray. And that was basically it. And in the NICU, you're not allowed to use your phones or anything. So I ended the call and I cleaned my tears and acted like a normal person, and then went back to meet them. And I just sat down there and I was just trying to process everything, saying the prayer in my head, and just saying everything that is like the Bible verses, different things. I was just saying, no, Laura, you would not die, you would live to testify. Laura, you would hear the word of God. I kept saying, you would hear the word of God. You have to hear God speak to you. You would hear. So I just kept saying that, because for me, it's like God created us in his image, and his image is not deaf. God hears. So if God can hear, why can't we hear? And those were the words that I was holding on to. And yeah, that was basically it. And then we had the room. It actually was the day we came for the rooming in. I literally packed my bag. It was supposed to be the day they would give me a room to stay with her for the next 2 days. And then we're hearing that. So it was like, I don't understand. It was not the kind of news I expected to hear on that day. So that was basically how I felt in that very moment.
Yeah.
And then the rooming in started. So we were then moved to the ward where the rooming in would be, and that was the first night that I spent with my child after giving birth. So 5 weeks later was the first time I was spending the night with her since I gave birth to her, and it was very beautiful. I even took a picture at like 4 a.m. or something. I was really, really, really happy. They say, oh, you wouldn't sleep on the first night, like the first time. You would be like, oh my God, is this my child? I did sleep though, but I was so happy. Like, I was energized. As much as I had to wake up, feed her, change her, I was just so happy to do it, because it felt like I finally have the chance to be a mom. At first, it felt like I was visiting someone else's child. I remember telling you that I feel like I went to the hospital and they took my child from me and then sent me home. And then they said, oh, come every day and visit somebody else's child. That was how I felt. It didn't feel like I had a child. And it was such a terrible thing. So having to then be alone in a room with this child that I'm supposed to shower, feed, change. It was just like, oh, wow, so I get to do this. And like, you mean everything is fine and I'm able to do this? Oh, mind you, before this rooming, they had done one other genetic test before then, and they said the result was going to be out like the next week. Yeah, so
it was on the day we were leaving the hospital.
So 2 days later, they asked me if I felt comfortable about taking care of her and everything. I said yes. I knew all the medications that I would give her at the times. They gave me like a medication plan. So everything, I basically had it figured out, I would say. And then they were like, okay, fine. So we can now discharge you. We don't have any reason to keep you here anymore. But of course, with so many follow-up appointments with like specialists and all. And even as at this time, they still kept telling us we are still investigating the reason for the methemoglobin spike. We still need to know what caused it. And one of the things that they were checking was this very genetic test. So we're waiting for that result. Then on the very day that we're leaving, literally like they were bringing the discharge papers and the genetic test results came in. And then how did you feel when the results came in?
I felt relieved, to be honest, because if it is genetic, then basically there's no cure.
Yeah.
So if there's no cure, it means that this is something that you would basically deal with for the rest of your life, and you don't know when it would happen because it's genetic. So the result came back and they said no, that the specific, so they tested for a specific disease.
Yeah, it was something that had to do with deletion.
That has methemoglobin as one of the side effects. So that was what they suspected, and when they did the test, they said no, that it was negative.
Yeah.
So that was I felt relieved, of course.
Yeah, we were so happy that day. And I remember putting her in her car seat. I had dressed her up with the clothes that my mom bought for her, and then I put her in the car seat, and I was just so happy because I was like, finally you get to use your car seat, and then they gave us all these appointments, told us, like they of course have to still watch her closely because of the VSD, because of the hole in the heart, and we were advised that she has to see a cardiologist every 2 weeks. So every 2 weeks a pediatric cardiologist would have to check her to see how she's growing, like is the hole increasing, or is it reducing, is it going in the right direction. Basically just closely monitor her while she puts on weight and they feel like, okay, it's time for her to do the surgery. So
then we went home on the 35th day.
37th day.
Oh,
so Romanian was like 2 days,
okay.
And then we went home on the 37th day.
Yeah, and then
she finally slept in her bed.
Yeah, and it was good. It was good. So we, of course, time went by. We gave her medications. We monitored her growth, and at a specific occasion, it was really bad.
I think it was about 2 weeks later.
Okay, so about 2 weeks later, she had like difficulty breathing, and it was really bad. Even when she's breathing, you would hear a whistling sound, and she was breathing so fast, even when she's at rest. Because if she's crying, you would understand, but when she's at rest and she's so it was not good. So we had to call the hospital, and then they told us to come over.
She was also throwing up.
And she also really threw up. Yeah. So the hospital called us, told us to come to the hospital. We went there, and then they basically observed her, and then observed her medication, and then they decided to bump the medication and increase the dosage.
They first had to give her salbutamol to help her breathe, and the next time they gave her adrenaline to help her breathing. So this was like
the short-term relief. Yeah, and then eventually they bumped her medication, and then monitored her to see how she would react to this increased dosage.
Yeah, they bumped her medication because they figured out that she had grown. So the previous dosage that she had was no longer effective. So they called it a heart insufficiency. It was not sufficient for the heart to work with that dosage anymore. So they had to then increase her dosage.
Yeah. So they did that. After increasing the dosage, they had to monitor her, of course, to make sure that this increase doesn't negatively impact her. So they did this monitoring for, I think it was 2 days.
Yeah, in total, we're there for like 4 days.
Yeah. And then they finally sent us home with an increased dosage. And then, of course, we went home. We continuously fed her with the same diet or the same level of milk and supplements, but now with an increased dosage. And she's been responding quite well.
Putting on weight.
Yeah. Also adding weight. It's still slow, but it's increasing. So that's a good thing. So currently we're basically currently feeding her, of course, hoping to God for healing, and just waiting for things to get better, waiting for her to gain weight. And then in the near future, it seems like she's going to have to undergo a heart surgery for them to close the VSD. So I think that's the up next. Is there anything else?
So she has basically grown bigger, and because of that, of course, the quantity of food that she was eating seems to now be too small for her, and she seems to be getting, of course, more hungry despite the added supplement and all. She's like getting hungrier and all. And then we asked them at the hospital if she could eat more, but we were told that that's not something they can just easily do, because more fluid again would mean more fluid in her lungs, and that would be a problem. So at the moment, they want to observe her and possibly prepare her for the surgery, because since they can't increase the dosage and the main reason for not dosage, well, they can't increase her food quantity, and the main reason for waiting for a while to do the surgery is so that she can put on weight. So, but with less food, she wouldn't, of course, put on the weight that they need her to. Then it's like they just might already do it. So that's basically where we are now. At the time of shooting this video, we have packed our bags and we'll be going to the hospital. We don't know when they will do the surgery, but she will be under observation and they will make that decision with the team. So pretty much this is a developing story, if I must say. But one thing we know, and one thing we've held on to for so long, is that we know that God does not leave you halfway. Like, God would not leave us halfway. He would not start what he cannot finish, and that's something that we've held on to. In the last couple of weeks, we've been having this devotion about like relentless faith and persistent hope, or is it the other way around? Yeah, relentless faith and persistent hope. And in this devotion, it has talked about, like, the woman with the issue of blood, and how all she just needed to do was believe that if she touched Jesus's garment, she would be healed. And that's basically, what we're doing. We believe, we know his capability and we know what he can do, and we are believing that he's going to finish it. They're also considering doing more genetic tests, because again, they still don't know where all of this is coming from. They've done reflex tests and all these tests, and she seems to be doing very well. So we are waiting to hear more news, and then we would see. But then again, we know that God would not leave us, and he would finish what he has started, and that's what we are holding on to at the moment.
Yeah, I hope our story brings some comfort to anyone who is in a similar situation. If you have been in a similar situation and you would also like to let us know how it's been for you or how you've succeeded, also feel free to let us know in the comments or reach out personally if you prefer. But yeah, that's basically it from us. Unless you have anything else to say, we bid you good night. Good day. Bye-bye.
Bye.